Hi, I'm Ellie.
And I'm Anisa, and we attended the UW Global Health Community Health and Disparity program in Nepal last summer in May.
So we were there for a total of 3 weeks, and for the first major chunk, we were in Kathmandu. And in Kathmandu, we met with local organizations, and these organizations were government-run, they were international and local NGOs, they were faith-based programs, clinics and hospitals, and even entrepreneurs within the country. And while meeting with these individuals and organizations, we understood more of the determinants of health within Nepal, and it really brought to light and solidified some of the major topics we'd heard over and over in classes here back in Wisconsin, but just put a personal and firsthand experience with them. One of the highlights of the overall trip was the homestay. We went to a small remote village, as remote as we could get in the time we had. And there we stayed with a host family and learned about their cultures and traditions and ways of life. But we also completed a Shramadana, which is shared labor with the community. So we worked with the school children on one of their days off to help them build a soccer field, start a foundation for a new bathroom, and build a fence along one of the ridges in the mountains. And so this was one of my favorite memories because we made personal relationships with a lot of the locals, and they were very appreciative of our time and efforts in helping them, because with that many people, we were able to get a lot of work done in a short amount of time. So many individuals on this trip were completing their global health field experience, and I was one of them. And so this program initially sparked my interest for its focus on global health, but there were other peers on the trip who had no health background, and it was really cool because we studied other areas like education, local scientific research, and how Nepal and individuals in Nepal are trying to combat climate change. And so it really encompassed a lot more than just health.
Yes, definitely agree with all of that. And then just to echo kind of what attracted me to the program, because there's a lot of really great global health field experience opportunities. But I think what stood out to me in the end when learning about the Nepal program was the emphasis on the shared labor contribution that Ellie touched on before, which is called the Shramadana approach. And basically, this offers an inclusive and respectful way to offer volunteer work where it's a shared learning process. So we aren't going as students just to volunteer and it being a one-sided event, but we really were able to engage with the communities. And the communities are also very reciprocative and engaged and encouraged to teach outsiders like us. But we could also help and provide knowledge and play a role in progressing the community through collaborative efforts. And gaining firsthand observation of the disparities in health and well-being between different populations has allowed me to reflect and draw on comparisons between Nepal, Madison, and my local hometown in Chicago. And this experience definitely emphasized that no one approach can be universal. And it was insightful to gain knowledge about non-Westernized treatments. And finally, being able to study healthcare systems cross-culturally is really important, and going on this trip definitely provided a stronger context for understanding demographics and health infrastructure. And I had the unique opportunity, along with my peers, to gain a better understanding of urban access health, which honestly is a strategy that's often overlooked in the United States, but it still remains vital to evaluate. So all in all, I think we both can say we would go back to Nepal in a heartbeat. And obviously the program partners with a really great organization, Teach for Nepal. And if you attend and are able to travel in your future, you will meet really great people who are really happy to have you. And we hope that this experience can go on for years to come.
Highly recommend.